The National Broadband Plan sets the goals of providing affordable broadband coverage to every American in the next decade. How would you evaluate the government's performance so far? That's a big question. And how are you working to help reach these goals? And I know you, Ms. Sanders, you've already addressed some of those, so please, if you will.
When you look at the National Broadband Plan, I believe it's Section 10, and I've got some, in my written testimony, I've got some exhibits that talk about the needs for healthcare providers, a minimum of 5 megabits for a single physician office to have enough broadband to do electronic medical records. For those in the healthcare industry, the adoption of meaningful use electronic medical records is very important. In coming years, they will be penalized for not adopting electronic medical records. So it's something that has to happen. Programs like the USF Rural Health Care Program are a huge step forward. It has taken a lot of time to put our program together, but I think we're at the tip of the iceberg, and as the years progress and as we continue to build trust and relationships with all of our healthcare participants and the vendors that we're working with, that we will see the benefits that we need to see.
I would say that we've made tremendous progress in the national broadband area. Certainly when you look at some of the interesting new applications that have come online in terms of healthcare and education in particular, there are lots of exciting new things. But I think there's still a lot of work yet to be done. The general criticism that I would have is I think we just need more flexibility in how we're using the dollars. I mean, I think we're still tied to a telephone landline model in an era where we're moving from telephones to digital outreach, and even within the digital sphere, we're moving from fixed lines to mobile. I mean, within 5 years, most applications are going to be mobile. And I think even in the healthcare area, there are exciting new opportunities developing in mobile health. We've done studies at Brookings in terms of some of these new programs that are going online. So I would just encourage Congress and certainly the various federal agencies to try and build a little more flexibility into some of these programs.
Speaking on behalf of Northwest Cell, my company in the last 10 years has constructed from 12 cell sites to 29 or 35 cell sites, I apologize. And we've even included 3G wireless service. I mentioned a couple examples where we have 3G service and we've been able to support farmers and public safety agencies. We've done this through the support of USF, and the system that we've been or we've been currently using has been working. And for the past 3 years, our company has been under a cap, and we've still we're not contributing to the growth of the fund, so we're still continuing to offer broadband service in our region. And we continue in order to migrate into 4G services and support the growth of mobile broadband service. We need to continue to receive funding to help do that in unserved areas.
At Yadkin Valley Telephone, we've made a lot of progress towards our broadband deployment. Since 2005, we've spent a little bit over $40 million on fiber to the home. We haven't gotten to all of our customers yet, but we're certainly working on that, and we are constantly hearing from small businesses how they need more speed, and we're able to do that with the fiber. But even now with the download speeds that we're offering in those areas up to 25 meg, we're now hearing they have demands for higher speeds going the upload speeds. So they want it both ways now, and that's a requirement. And we've also seen a lot of small businesses in our territory taking advantage of the broadband. We recently had a company, a Southern Farm Supply, and we installed 12 computers there. We actually are their IT provider as well. And obviously they use our firewall service also, so they're using the internet for their business, and they're in our area. We have another trucking dispatching company that has been able to put people in their homes to work to do the dispatching because of the broadband that we provide to them. So that's been a great efficiency builder for them and has enabled those people to work out of home. We've also we've had a couple of different companies who've bought IP phone systems that they're in the rural areas, and these enable them to connect with other companies outside of our area as if they're on the same phone system. The IP system's doing great. As far as the broadband plan, we were fortunate enough to just last year receive a BIP. We got a BIP of the loan grant dollars. So that's going to enable us to get even to the more rural areas where you have hardly, very, very few customers per mile. But we can only use that money in underserved areas. We can't use that in our whole territory, but we are taking advantage of that, and that's working along well. We are striving to get 25 meg out to all of our customers over the next several years, but with the regulatory uncertainty with the Universal Service Fund, it really makes us weary of really committing ourselves to a lot of investment right now and not knowing what the future is going to be, because we really rely on the universal service and intercarrier compensation to help us recover the cost of our network. And we have a lot of users on our network. We have long distance carriers, and we work with the wireless carriers to carry traffic. So lots of times for the heavy traffic, when it hits a tower, they then connect to our fiber, which you got to have that to be able to carry the heavy data usage that's coming and is already here. Thank you.
Thank you. And I have one more question for now, and this question is for Ms. Sanders. In your testimony, or excuse me, let me back up. I'm looking at the wrong one. Earlier today, the Gallup poll actually put out some poll data that I think speaks volumes. 48% of small businesses are not hiring new employees due to rising health care costs, and 46% are focused on uncertainties in the new government regulations. So my question for you is the effect of the broadband on health care. Do you feel, or how do you characterize the access of broadband in reducing the costs of health care for your facilities? And do you believe it has helped small business health care facilities become more independent and viable?
That's a really good question. I wish I had a crystal ball. There's a lot of uncertainty in healthcare reform as well as universal service reform and intercarrier compensation. And the answers to those questions will help us solve and answer this question. From the rural healthcare practitioner standpoint, I've seen a lot of use of telemedicine over our network and other networks as well that we've been in touch with. There is, just like electronic medical records, just like any new technology, any new procedure, there's a little bit of chaos when the change first comes in, but once things calm down, most practitioners are finding that they're able to see more patients and be more productive with electronic medical records. Now, in a telehealth situation, a specialist could stay in an urban area and see patients all over the world. That makes them even more productive in their day. Instead of a lot of physicians today from metropolitan areas in Indiana will spend a day on the road, a day here, a day there, and see patients, maybe once a month in a rural community. They've got travel time on the road. They're not nearly as productive as they could be over telemedicine.
Thank you so much for that input. And now I'm going to yield to Ranking Member Richmond for his questions.